Hi everybody, so welcome to my first Facebook Live. My name's Harriet and I am one of the newest Bud team members, and I think the only one from the UK, which is very exciting, and it's a real honour to be part of such a great Facebook community and team. So I wanted to just tell you a little bit about myself. I did my training at King's College London, which was a 4-year Bachelor of Science degree in nutrition and dietetics. And the way that it works in the UK is we do 3 hospital training placements during the 4 years. In a variety of different clinical settings. So I worked in oncology, which is cancer care in a London hospital. I also worked in a community hospital, so that was going to visit people in their homes and in doctor's surgeries. And we also had to do a public health placement. And I worked in South London trying to increase rates of breastfeeding in the community, which was a really interesting project to be involved with. So then I graduated back in July, so relatively recently. And after my whole degree, I actually began to think, is dietetics something that I want to do? Because I also love writing. And what I did after graduating was I got myself an internship with a PR and marketing agency within the health sector. And I worked with them for about 4 months. And that was a really interesting, different perspective to anything I'd done during my clinical dietetics degree. And I really enjoyed the work. I was working with some really big pharmaceutical and nutrition companies. We were doing press coverage for them. So if they had a big announcement on one of their drugs or one of their nutrition supplements, we would write the messaging behind the announcement and get media coverage for them. So I did that for 4 months. And then after that, I realized that I was really missing my dietetic work. And that's when I thought I've got to go back into clinical dietetics. And some of you may know through my work as Surrey Dietitian, which is the name of my business, that I also have a couple of chronic health conditions. And that was part of what inspired my whole journey as a dietitian. So back 6 or 7 years ago, I was diagnosed with scoliosis, which is curvature of the spine. And I actually had to have spinal fusion surgery at the age of 16. And to cut the story short, I have a couple of titanium rods and lots of metal screws holding my spine in place. And whilst I've recovered relatively well now, after the surgery, I lost a huge amount of weight and my recovery was really hindered. And so I was referred to a dietitian in the national healthcare system here, which is known as the NHS. And she gave me some really helpful and useful nutrition advice. And that was that light bulb moment when I thought I really want to be a dietitian. So now 5 or 6 years later, I'm qualified and I do have these chronic health conditions. I experience quite a lot of chronic pain. And for me, that meant that I wasn't going to be able to work a typical clinical job in a national hospital in the UK. And so I decided quite early on in my career as a dietitian to go freelance. And I set up my own business, Surrey Dietitian, 4 months ago now. So it's all relatively new to me. And I have had to really learn everything as I've gone along. And it's been an incredible journey over 4 months. And I've been really lucky to have had some excellent mentors along the way. I would say that I predominantly spend 50 to 60% of my time working as a health writer and a health publicist. So I work 1 day a week as a freelance health writer for a PR and marketing agency in London. And as part of that work, I write press releases and get media coverage for nutrition companies. I then see clients about 1 day a week. I either do online coaching, particularly with people who've got chronic illnesses like fibromyalgia, Ehlers-Danlos syndrome, which is quite a rare condition, which requires a very specialist approach. And I've had a few patients who've really found benefit from following a low histamine diet because they have something called mast cell activation syndrome. So if you're interested in hearing more about that, do message me, and I'd be really happy to chat to you more about what I've learned along the way. So I see patients about once a week. I also approached a local health club near to where I live, and I noticed that they didn't have a dietitian or nutritionist, and I pitched my services to them. And since January, I've become their club dietitian, which has been really great because the club has over 16,000 members, and they do a lot of marketing around the fact that I'm a freelance dietitian, and we've done a couple of talks together, and that's brought clients my way. I then spend about 2 days of my week doing freelance health writing. So I actually built up my writing work when I was a student dietitian, and I contacted one of the big nutrition magazines in the UK, and I said to them, I'm a student, I'm very keen to build up my writing, and I can see that you haven't got any students writing for you. Would you be interested in a column? And luckily they said yes, and for the next 2 years as a student, I developed their column in the magazine. And that was a great platform for me launching my career as a health writer. And I went on to actually win a writing award with them last year. And that has been very, very useful when I've been pitching my writing services to other companies. I can see that I've just had a question come in. Do you find working at the club, you spend a lot of time busting myths? Do you help to educate staff members? That's an interesting question. I did my first launch event this week, and I kept it very, very simple. It was about eating well and living well in the new year. And people could send their questions in advance of the talk. And some of the questions were things that I've been trying to bust for years. Are carbohydrates fattening? Is gluten bad? Are all proteins equal? And I think sometimes as health professionals, we maybe take it for granted that these are very simple messages that everybody knows. But actually the public, particularly in the UK, are still very confused about these sorts of things. And so I spent a lot of the talk busting some of these myths. In terms of working with the club staff, that's something that's on our agenda to do because the food in the canteen, I gather, is not particularly good. The morale amongst staff is a little bit low. And so we're looking at ways to improve the health and well-being of staff. So I think doing some talks and offering some subsidized consultations to staff members is something that we're looking at doing. Hello, Tracy from America. It's great to see we've got some people joining from all around the world. And I'm actually half American myself, which some of you might not know. A lot of my family are from the East Coast, near Philadelphia. So it's great to see we've got some people joining from America. So anyway, going back to what I was saying, I spend, yes, about a couple of days a week doing health writing. Now, initially, when I started out freelance in September, I started to do lots of writing projects for free. I approached charities, I approached local groups, local newspapers, and I was just really keen to kind of build up a presence with my writing. And that's actually paid off in the long run because it's given me a platform and portfolio of work to send to other clients when I'm pitching for paid work. So to give you an example, a couple of months ago, I pitched to a nutrition supplement company because I noticed that they didn't really have any written articles on their website, whereas some of their competitors had some really good articles for dietitians looking to do CPD. And I pitched my services, the company were interested, they ended up offering me a year-long contract, which I've just begun this month. And that was a great example of why unpaid writing work can pay off in the long run. In terms of other writing projects, I ghostwrite for several dietitians who don't have time to do their own blogging on their websites. So I write the content for them. I'm also ghostwriting for quite a well-known scientist at the moment as well. Obviously, when you're ghostwriting, unfortunately, that means you can't reveal who the clients are, which means you can't, put up the portfolio of work on your website, for example. Another thing I wanted to talk about quickly was when I was a student, I ran a project called Fight the Fads, which some of you may be familiar with. essentially we were a social media platform which debunked nutrition myths in the media. And we did this for several years. I did it with 2 other student dietitians, and we amassed about 10,000 followers on social media. And it was very much at the time that clean eating was becoming a really big thing. And a lot of the messages out in the newspapers in the UK were just so confusing. So we found that putting really simple messages out there that, you know, carbohydrates are actually good for you, that one diet doesn't suit all. These messages were very well received. And we then went on to launch a government petition to try and legally protect the title nutritionist, because in the UK, the title nutritionist is unprotected, and that means that anybody can call themselves a nutritionist. That's really frustrating for people like myself who've done an undergraduate nutrition degree. We're competing with these people who've perhaps not done any scientific training. And the petition actually got 10,000 signatures from members of the public, which was a fantastic response. And it then received a response from the government, which wasn't quite what we were expecting. They did acknowledge that it was an issue and that they were doing more work to try and improve the protection of title. But since the 2 years that we did the campaign, unfortunately, it remains unprotected. I can see some of you are pretty angry with what I'm saying. But the Association for Nutritionists in the UK, which is called the AFN, did use our petition as a sort of leverage with some of the campaigning that they're doing. And they've reduced their target for achieving protection of title from 10 years down to 5 years as a result of our petition. So I think that, you know, that can only be positive. So I now run Surrey Dietitian on my own as my own business, and I think somebody was asking, I've got a couple more questions. Do you find it challenging to eat well with a chronic illness? Yes, I do, and that's one of the main messages that I try to get across on my social media platforms, because I'm finding that I'm working quite closely with other people with chronic illnesses like myself, because even as a dietitian, you know, we have 4 or 5 years of nutrition knowledge, yet when you're feeling very, very unwell and you're suffering with symptoms like chronic pain and fatigue, it can be hugely difficult to eat well. And, you know, even the thought of preparing food or going out to buy food can be challenging sometimes. And so I'm doing a lot of work on social media at the moment to put across a message that you don't have to be, you know, preparing beautifully cooked homemade meals every day to eat well. You can be using processed and convenience foods like tinned fruit, frozen fruit, smoothies, and these foods can all play a role in a healthy and balanced diet. But I think we've certainly got a lot more work to be doing. Another question, I think that's Leah saying, I remember when you were with Fight the Fads. Yeah, that was a great few years, and it opened up again lots of opportunities. We got some coverage in some very big newspapers in the UK, which was very exciting. And I think it just reiterates that, you know, as health professionals and as dietitians, we can be doing so much to educate the public. And some of you might have seen on my Instagram page yesterday, I posted something about a patient that I saw this week who was inappropriately started on a low FODMAP diet, which, as you'll know, is a hugely restrictive dietary regime. And for somebody who's in their mid-80s, it's not perhaps indicated if the patient isn't willing to try it, which this particular patient wasn't. And unfortunately, their doctor was the person who recommended that they started the FODMAP diet. They didn't have much interaction with a dietitian. They were left on the diet for a year and they lost 8 kilos in body weight. And so that reiterates why nutrition advice should really, well, particularly clinical nutrition advice, should be left to registered dietitians. So yeah, I think we've got a lot more work to be doing, particularly in the UK. We need to continue to raise our profile of dietetics. We're a relatively small profession in the UK. I can't remember the exact figure. I think maybe someone who's watching can fill me in, but I think it's probably around 15,000 dietitians in the UK. And there's certainly a lot more nutritionists out there, and nutritional therapists and people who are perhaps better at getting their messaging and marketing out there than us dietitians. you're consulting with patients in Canada and the USA. I think that's a question from someone in America. So actually, I've been speaking to a colleague about this week because we weren't sure whether if you're registered in a particular country, you can work with clients who are outside of your country. And my understanding is you need to check with your insurance provider to see whether or not you can work with clients in different countries. And I think it really varies according to who you're registered with. So definitely check with your insurance company before you start seeing patients outside of your own country. Another question, Harriet, I know you watched some of what's going on in the nutrition space in the US. How do you think we in the UK are different when it comes to the work that dietitians do with food, fad, and issues? That's a good question. I think perhaps US dietitians are better at putting their own opinion out there. I think perhaps UK dietitians, because we are a small profession, we're very, very worried about speaking against things, getting anything wrong, and receiving criticism from the public and perhaps other nutrition professionals. I've seen some really good campaigning from US dietitians recently about celery juice. I don't know if any other dietitians have noticed, but the celery juice trend seems to be taking off on social media. And I've actually tried to tackle it on my own Surrey dietitian profile, and it resulted in me getting trolled by a lot of the celery juice followers. But I think, UK dietitians, we can probably be a bit louder. One thing that I've noticed with US dietitians is some US dietitians work very closely with companies to promote their products. And I think some dietitians in the US are probably sponsored by these products. And in the UK, I think more dietitians are beginning to work with companies and receive sponsorship, but we actually have some new regulations and guidelines that came out last week about whether or not dietitians can endorse and promote particular products. And in the UK, we now have to make it very, very transparent on any social media posts, whether or not we're paid or sponsored by a company. And before, it used to be sufficient to put, hashtag ad if you're doing a post about a product. But now you need to let your followers know whether you've received a fee for doing the post, how much money you received, if you receive commission through people clicking through to the link in your blog post, for example. So we do have to be very transparent in the UK. Historically, we've had to be careful not to appear to promote one brand over another brand. So dietitians used to have to say, I think X yogurt is good for you, but Y yogurt and Z yogurt are also available. Now, I think perhaps US dietitians are a bit more bold in their approach, and they might just say, I think X yogurt is great, and my clients should be having X yogurt. And I think we could do with having some clearer guidelines in the UK about what we are and what we're not allowed to do. And I think that's something that our professional body is working on at the moment. So here in the US, heart disease, cancer, and chronic respiratory disease are the most prevalent causes of death. How does this compare with the UK? Okay, you've caught me on the spot there because I can't remember the exact figures off the top of my head, but I know that we do have huge issues with heart disease and cancer. I'm not quite sure where chronic respiratory disease rates in the sort of top 5. But we've got a huge emphasis on preventative measures in the UK at the moment. So reducing risk of cancers. There was a lot of publicity a couple of weeks ago over fibre. Don't know if anyone saw the new fibre paper that was published in the Lancet, I think. And we had a new advert come out on the television last week aimed at children about promoting increased fruit and vegetable intake. Because we know that eating lots of fruits and vegetables reduce our risk of diseases like cancers. So I think probably we've got a lot of overlap there with particularly heart disease and cancer in the UK. Just seeing if we've got any other questions that I've missed. Don't think we do. But yeah, if anyone is interested in knowing more about health writing or health publicity, I think these are areas that not a lot of dietitians, particularly in the UK, are working within, then I'm more than happy to chat to people and share my experience. I just remembered that someone sent me a question earlier and asked me if I'd talk a bit about social media and how I've used it to build my brand. Like I mentioned, I've only been on social media for about 4 months. So I'm still relatively new to Facebook, Instagram, and I'm learning how all these different platforms work. I think a lot of it is trial and error. I've had posts that I thought, oh my gosh, that's not doing very well. I don't know why I wrote that. I've had other posts that have really had a fantastic reaction. I think you need to know your followers, who's following you and what do they want. So on my Surrey dietitian page, for example, I do have quite a lot of people following me of chronic illnesses. And these are people who've they feel like they've exhausted all options. They've seen countless healthcare professionals. They've tried lots of different diets. They're very frustrated. They feel that healthcare professionals don't really understand what they're going through. So for me, chronic illness is one of what I consider to be one of my niche areas. Also my health writing, I have lots of dietitians and student dietitians following me who want information on how they can get into these areas themselves. So I make sure that some of my content is aimed at sharing which projects I'm working on, for example. I think it's very important to engage with your followers on social media. So liking, sharing other people's posts, getting involved in conversations. I'm actually very camera shy, so doing a Facebook Live is quite a big thing for me, but I think I probably need to do more of these videos, because I've noticed from this week when I shared clips of a talk that I did at the RAC Club, my followers went up by about 50 in a couple of days. So I think, video footage is very much the way forward. We've got a couple more questions coming in. In 2014, COPD was the third leading cause of global death. It's a cause of 1 death every 10 seconds. Oh, okay. That's a good statistic to have in my head now. Thanks, Kirsty, for sharing that. Gabby Goodchard, what have you found to be the biggest challenges of being freelance? Oh, that's a good question. I think what I found most difficult is juggling a work-life balance. So when you're running your own business, there is a pressure to be making enough money for it to be sustainable, but also for you to find balance, particularly if you're managing a chronic illness like myself. You need to make sure you have time to relax and switch off. So I think really quite carefully before I take on any project, am I able to realistically balance the workload? Am I able to deliver a high quality of service with the amount of projects that I'm taking on? And like I said, I did begin by doing a lot of things for free, and I made sure that the amount of money I was charging was reflective of the fact that I was a fairly recently graduated dietitian. I think as you gain experience, particularly with the writing, you can begin to increase how much you charge for your services. But I think, never say no to any opportunity. In fact, some of the opportunities that challenge you the most are things that you're a bit on the fence about whether or not you should accept. And these are often the opportunities that lead to, open up countless doors for your career and opportunities. So I think another issue in the UK that Gabby and I have been working on a lot is GDPR. So this is all about data protection laws. So last year we had a huge amount of changes and regulations come into force in the UK about how we handle, store and manage clinical data. And you have to register with a data protection organisation called the ICO in the UK. You have to pay a fee. I think, Gabby, is it about £50 you pay? And you need to make sure that any kind of clinical data that you're storing on patients is stored in a GDPR compliant software system. You need to make sure that if you're sending any attachments to clients over email, that you're doing it through a GDPR compliant email system, or you're password protecting the documents. There wasn't a lot of information out there for health professionals, particularly freelance health professionals. And so Gabby and I actually set up a sideline business developing a set of GDPR compliant resources for dietitians. So we created consent forms, because with GDPR, clients now have to opt into marketing. So you used to be able to send out all your clients who are on your email contact list. You could send them advertising, you could send them emails, marketing emails, but now you have to get every client to actually tick boxes consenting to email or telephone marketing, and you can't send emails if they haven't consented to it. You also have to have your own terms and conditions, which you send to clients, and they must sign them before a consultation. You need to have a privacy policy, which you must display clearly on your website. You must have correct website wording. So if someone submits an inquiry via your website, they must, again, click a consent box, consenting for you to contact them regarding their inquiry. And so Gabby and I have spent months trying to get our heads around GDPR. We've paid a lot of money to solicitors to get their advice to make sure we're doing things the right way. And we have ended up selling these resources to other dietitians, because if 4 months ago I could have bought these resources, I would have saved myself months and months of money and worrying. But I do think it is important to make sure you're going about things the right way from the start of going freelance, particularly when you're handling such confidential patient data. Gabby says that the fee varies according to the size of your company. It's about £40 to register with the ICO in the UK. Gabby and I are very happy to chat to any UK freelance dietitians who'd like to know more about GDPR and the resources that we've created. So I think that's probably everything from me for now. If anyone's got any other questions, please feel free to contact me through my Surrey Dietitian Facebook page. I'm on Instagram, Twitter, and of course I regularly post on the Bud Dietitian Facebook page as well. So I hope you've enjoyed getting to know me a little bit, and thank you, Leah, for this opportunity to introduce myself, and I'm sure I'll be back on Facebook Live again soon. So for now, thanks for listening and goodbye.